I wrote this article in 2019, and I think that the title still holds to this day. I think it's happening more and more, especially in our current cultural climate, which we're finding ourselves in, which is that we tell men to open up more, but are we ready to listen? What we found with 4,000 guys in a Movember study is that 41% of them had regretted opening up to someone about their mental health. And I wrote that these men reflected on how opening up resulted in them feeling like they weren't taken seriously, had lost respect, or were made to feel embarrassed or weak for doing so. Now, when we look at what's happening with consent and sexual assault and mental health and domestic violence, all of these issues are directly interlinked, and they're interlinked with masculinity, and they're interlinked with the way that men are brought up and told to interact with the world. And if we don't have spaces and places where men can go to have these conversations, to have honest and brutally aware conversations where they are understood and heard, then again, we risk that distancing effect, that shaming effect, which actually we know from the research, and I've conducted plenty of this myself, enrages men, and it makes them feel more shame-filled and guilt-filled. And it's really problematic in the long term. So obviously we have plenty of responsibility on the men to regulate their emotions and be aware of what's going on for them. But society has to find a way to adapt this stuff so that we can, really connect with them. Because at the moment, we have this idea that men are seeking help. We're breaking down that trope. We're breaking down that stereotype that men don't seek help because it's not useful and it's not true, but men are still dying. So what are we assuming here? Well, we're assuming that men don't self-refer. Sorry about these crosses. They shouldn't necessarily be there right now. Men don't self-refer when in fact the most common referral pathway in my study was that they were self-referring, they were self-motivated. Men feel ashamed going to therapy is the second one. Well, the vast majority felt none to very little shame, 65%. Men aren't motivated to attend therapy. This is the third one. Well, in fact, almost half of the sample were very to extremely motivated to attend. Men don't like to talk. Well, no, the best thing about therapy for the vast majority of them was the space to talk. Men only want to see male clinicians. And I'll discuss this in a second. That is not true either. We need to stop assuming and start asking. I find it really strange that I do this research where we try to mix it up. We think, oh, should we do some experimental research? Should we do some RCTs? Should we do some really unique methodologies? And then we go, no, we just need to survey these guys because for some reason, for the past 50 years of psychology and psychiatric research, nobody's been asking guys what they want. And so we go back to basics. And the fact that this survey of 2,000 guys is the largest that's ever happened looking at men's help-seeking behavior and engagement in therapy is really telling and explains this disconnect in experience and outcomes. So an example of this assumption is that gender, most importantly, the gender of the therapist is often believed to be the core construct here. Lots of female clinicians say that they feel uncomfortable, for instance, with male clients. Lots of male clinicians feel that there's too much of a competitiveness, for instance, or there's a clash with some of their male clients. They're too close in age, they're too similar, whatever it may be. There's a lot of talk about this stuff, but there wasn't very much research. There's a lot of talk around in the media around the fact that men only want to see men, or men can only find female therapists. There's all of this popular ideology around this stuff. But when we actually ran the research, we found that 61% had no preference. A good therapist will always prevail. That's what it comes down to. It doesn't matter your gender. It doesn't matter your experience. We treat people of all shapes and sizes, of all colors, of all ethnicities, of all genders. It's really important that we just try to find a way to connect with them, that we find a way to understand their experience. And so when we broke it down and asked why do they, because there's still 20% who prefer a woman and 19% who prefer a man. We asked these guys, 382 of them, why they prefer male therapists. 45% of them said that, men are more empathetic or comforting, so I feel more comfortable opening up to them. whereas 69% of those who prefer female therapists are saying that. So that's obviously a much more common experience for these guys who prefer a female therapist. But the idea that men understand me better or easier to relate to for 26% of the sample of those who prefer male therapists, that's a much more common response. So it seems to be that empathy and comfort in women, in female therapists, and it seems to be that they feel much more related to for those who have a preference for a male therapist. But there's still 61% of guys out there who just don't care either way. They just want a good therapist. And so we need to have choice, and that's the key takeaway. If he has a preference, talk about it. That's the key. If a guy doesn't see a therapist of his preferred gender, he may experience heightened feelings of emasculation as he loses more control over the process, which can contribute to less satisfaction with care in the long run and impact his outcomes. So you've got the bulk of people who are fine with seeing anybody as long as they connect with them and they like them. Some people, though, 40%, have a preference either way. And if we don't discuss that, if we don't bring that up, if we don't ask about it, the satisfaction with treatment, and again, the likelihood that they're not going to return and the likelihood of crisis down the line really, grows with time. And so we want to get to the point where we can have these open discussions about what are we looking for? What do you expect? How do you think this is going to go? What were you hoping for here? And I'll talk a bit more about that later, because that is the essential 101 of working with men, and I would say women as well. But women are much more versed in some of these practices than men are. So their expectations and the mental health literacy is a lot greater than many men who have not been acculturated to this process. So what do men want? Just need to drop this in. I always see myself as the Mel Gibson in this process. I started to go around and just ask, what's going on? What happened? And have qualitative, deep interviews with some of these guys to understand what is going on for them and what they're seeking. Show him what it is. Show him what therapy, what counseling, what it looks like and how it works and how he fits in this process. So importantly, I asked, for 442 guys, I asked them, what are your top 4 facilitators for seeking help? What were the 4 main reasons you sought help? And the 4 top reasons were belief that professional support helps in recovery. So believing that it's useful is obviously extremely important to, make sure that you invest in this process. Familiarity with mental health symptoms, positive attitude about seeking help, and knowing how to access professional help. This stuff is all kind of around knowledge and expectations. What is going to happen? What does my recovery look like? What are my symptoms going to be? How do they work? Do I think that this is going to be a useful and satisfying experience? And how do I go about it? We can't just build it and hope they will come. We need to co-build, to collaborate, to communicate, and then they might come. And that's the key. Overblowing our estimations of what we're capable of here. We need to start small. We need to really build the foundations with, these guys who are willing at the moment, and then find a way to create this system where they go back out into the world, they connect with the men in their lives, and we get this referral pathway. Because at the moment, you don't have men going out, sitting in the pub and talking about their psychologist. We're getting there. There's enough woke young dudes that I see around my area who are discussing therapy, but it's so unusual to hear that. You can go and you can hear a group of women talking about therapy, any day. It's been happening for decades. We need to get to the point where men are talking about this stuff, because then this knowledge, all of this stuff, which is around expectations, around what to look for and what to expect, that will become a lot easier for men who are walking into it for the first time. So how do we do it? Well, in 2018, I ran a study with 20 guys who had been in therapy for depression before. And we broke down the key areas that need to be improved if we are to make sure that we engage these guys readily. The first was orienting to system, as I just said. And that is, what are your treatment options? Suggesting and discussing approximate length of treatment, stressing collaboration and equality, providing psychoeducation. That's all those first few sessions. Don't strive for outcomes immediately. Don't even assess immediately. Just get to know them. Just get them in the room as a human being and try to connect with them on that base level. Pacing is extremely important when working with your male clients. They may not move as quickly at the start as you'd hope or expect, but come session 5 and 6, I'm just getting a wave, a tsunami of emotion, because they are now connected, because they are now trusting and loyal, and they understand that you're going to stick around, rather than trying to fit them into your diagnostic box, trying to assess them based on your rating criteria. They can get really problematic for lots of these guys. The second is establishing trust and sharing control, which is directly linked with masculinity. Clarifying your role, sharing control, employing male-oriented language to make them feel like they are central in this process, and understanding what's going on. And I can describe what that language is in a second. Providing a roadmap of treatment as well. What's the way ahead? Where am I going here? Lots of guys want that action orientation, that goal-focused treatment. It's really important that we can provide that to them. And then action to empowerment is setting and reviewing goals, providing action-oriented, skills-based treatment. Behavioral treatment works really, really well with guys. Some prefer cognitive-based work. Some prefer, basic counseling. But in the vast majority that I've seen just want to get down, to the action point of it. They want to work out what needs to happen. And in a unique way, in making those shifts, they often come back and we have those cognitive discussions around what's actually going on and where it comes from and why as a result. So in their words, this was participant 14 who was in the army. I don't think a lot of people have confidence to ask. It's sort of assumed knowledge, and quite frankly, it's not around the mental health system. I think something as sensitive and personal as mental health, it's really good to have a breakdown of what options are there. Just sit down and go, this is how I work. This is what I do. This is where I have been trained in. This is what other practices are. And also being open to referral, because as I said, we have such a short window of opportunity. Them understanding that it's not a one size fits all and it might not work the first time. They need to understand how the system, actually responds to them and how it's going to work.